Awesome, thank you. I will give it one more minute. Yeah. Folks are coming into the room. All right, it is now 6 p.m. I'm going to call the meeting to order. Ms. Bell, can I have a roll call, please?
Good evening, everyone. Mr. Ojapinti,
Here.
Mr. Lee,
Here.
Mrs. Ian Garrett,
Present.
Ms. Tejada,
Here.
and Ms. Salahuddin.
Here, thank you.
You're
Moving
welcome.
on to the approval of the agenda. Dr. Deloria, are there any changes?
There are no changes.
Awesome, can I get a motion?
So moved.
Second.
All those in favor say aye. Aye.
Aye.
Any opposed? Nope, fantastic. Moving on to the consent agenda, unless anyone has any items they would like to pull, can I get approval of consent?
Move to approve consent.
Second.
All those in favor say aye. Aye.
Aye. Aye.
Any opposed? Fantastic. Moving on to public comment. This is the item on the agenda where we allow the public to comment on an item that is not on the agenda. So are there any people that want to, or any blue cards for any folks that want to speak to an item that is not on the agenda?
No, not at this time.
Fantastic. All right. So I'm moving on to our one action item for this meeting, which is our return to school plan. I will turn it over to Dr. Deloria.
Thank you, President Salahuddin. If the board remembers, earlier in July, you took action on a return to school plan that included us opening the first 6 weeks in distance learning. Much has changed since that meeting, much understanding. And at the last meeting, you asked that we would come back and consider a 100% distance learning plan for first semester, which I supported. Tonight, Ms. Baca is here, along with Ms. Casey, to share some revisions to that plan, and staff, including myself, are requesting that you approve the revised plan to participate in 100% distance learning for all of our students for all of first semester. And with details, I will turn it over to Ms. Baca.
Good evening, President Salahuddin. Good evening, members of the board. Tonight, I will share the revised version of the return to school plan. Share my screen. So the big change with this plan is the instructional model for the 2021 school year, more specifically for the fall semester. So we are proposing that the JUHSD will be operating at 100% at-home distance learning during the fall semester of 2020, and that the evaluation of what it will look like in the spring semester will begin in October, following COVID-19 data trends in the county and in our areas that the district serves. The first day for certificated staff will be on August 6th, and the first day for classified staff will be on August 3rd. However, starting August 10th through the 14th, students will be participating in various activities that will allow them to acclimate and get to know their teachers, pick up their Chromebooks, and participate in lessons such as social justice lessons, California, CCGI lessons, and the actual classes where the students would have to report to their teachers would be August 17, 2020. This plan also includes the bell schedule for Jefferson High School, where they will be operating under a quarter system where students will be taking 3 periods during the first through 9 weeks, and the other third period during the week of 10 through the 18th week. With their schedule, the change was instead of having an ABC cohort model, they just reduced it to A and B, knowing that most of the students would not be on campus. So what was proposed was that on Monday, there will be virtual learning synchronously for both cohorts A and B. Tuesday will be synchronous learning for cohort A. Wednesday will be scheduled office hours. Thursday will be asynchronous learning for cohort B, and then back again on Friday will be a combination of cohorts A and B for synchronous learning. There is no change for the bell schedule for Oceana, Terra Nova, and Westmore High School. They will have an AB cohort. So first, third, and fifth on Monday with cohort A, first, third, and fifth with cohort B on Tuesday, office hours on Wednesdays, and then second, fourth, and sixth with the 2 different cohorts on Thursday and Friday. Thornton High School would still have an ABCD cohort scheduled model with office hours on Wednesdays as well. Adult school will be participating in an online at-home learning during the fall semester and will be evaluating for the spring semester. Independent study is to be arranged with the independent study teacher, and the adult transition and therapeutic day school is still under discussion as far as how would their schedule goes, their bell schedule, but they will be following the 100% at home or distance learning model. This also includes the potential transition stages for the full return to school, because we just do not want all the students to come in all at once. We want to bring them in a small group at a time. So we've broken it down into different stages. Stage 0 will be at home distance learning and working remotely for all students and some staff. There will be no in-person instruction, and it will be virtual learning only. Stage 1, staff returns to work, but students will continue participating in 100% at home distance learning, but some groups may attend for an office hours on Wednesdays in person. And here at the bottom, it says potential students on campus for office hours. So we will start with our 9th grade students, our English learner students, students with disabilities, /504, our foster youth and homeless students. Stage 2, staff will report to work, and some students will be on campus for instruction. And here at the bottom again are some potential students for in-campus instruction. And this is when we are on a hybrid model. So again, instruction doesn't, what we're proposing is 100% distance learning in the fall, but our guess is that we will eventually have some form of hybrid model as the year, perhaps in the spring semester. So these are the stages for that. Stage 3, we've increased the number of students. The cohorts A and B will be followed. And then stage 4 will be the return to normal, all instruction on site. This plan also includes what would count as a daily life interaction as required by SB 98. And what we are expecting is for students to do work every day, and that students must attend at least one synchronous lesson or attend office hours and participate in asynchronous lessons or communicate with their teachers via Remind app or an email. And that students who are unable to attend their assigned cohort that day may attend the other cohort synchronous lesson with prior teacher's approval. Again, this is required by SB 98, and that attendance will also be recorded and reported. And with that, that is our plan that we are recommending for the board to approve this evening.
Sorry, I took a minute, Tony. Thank you. So I think at this time we'll move to any comment cards that we have on this. So I'll turn it over to Ms. Garrett.
So we do have 9 speakers tonight that would like to speak. Just a reminder for all speakers, you have allowed 3 minutes. on the timer, and I will notify you when it's a 1-minute warning, 30-second warning, and also when time is up. So I have, for the first speaker, I do have Alec Butler.
Hi, everybody. Can you hear me?
Yes, we can.
All right, good. I'm just, I wanted to give a comment on how much I appreciate you guys moving to 100% on at-home learning for the fall. Just to give an example, and I'm just an example of many people. When the fall was approaching, my family was increasingly concerned because by me going back to school, it's not just one exposure to COVID, but it would also be the potential exposure of my daughter at daycare. And we have some pre-existing conditions to worry about at the same time. So the probability increased to a point where it was just unsafe and quite terrifying. So I appreciate you guys looking at the numbers and making this adjustment. If I did have to go back to school, I mean, not only would our potential increase, but we could no longer even see our parents or my daughter's grandparents, which happens once every 21 days after 14 days of quarantining. So rarely now. So I just really wanted to say how much I appreciate it. The other question I just have is for teachers that do have kids. I know the district was looking into a possible option for them, because if it's not safe for us to go to school, then it's not necessarily safe for my daughter to go back to her school, even though they're doing the best they can. So I was just wondering what the plan the district comes up with, because I'm still trying to figure out the logistics of how to do that. I mean, I actually might have to move back in with my my wife's family.
And you have 1 minute, Alex?
No, I think that was it. I really appreciate it.
Okay, thank you for your feedback. Unfortunately, we're not able to comment on any questions, but we definitely hear you. So thank you very much. We appreciate it. So next we have Jamie Phillips.
Good evening. Thank you to the board for listening to me tonight. I'd like to start by offering great gratitude to the board for putting the health and welfare of our staff and students, and by extension their families, first, with the decision to start the school year virtually. As someone who is high risk, I'm also living with high risk parents, and this decision has benefited me greatly because I worry more about my parents than I do myself. And I know many of our students live with their grandparents, and their grandmas and grandpas are the same age as my parents. I know they have to have the same concerns that I do, because I've been up for weeks and weeks before this decision was made, worrying about what was going to happen to them. What if I brought the virus home? What if something happened to them? Was I going to be responsible? And this has just been on my mind constantly. And then I wondered, if school opens, would I be self-quarantining in my own home? Would this allow the care of my parents to suffer? All these kinds of big picture things. And thankfully, this worry has been alleviated some, but it's still out there. So I'm asking the board to consider keeping school closed for the semester until we have COVID-19 under control, so that myself and our students can have the ability to teach and learn without constantly worrying about our elders. This will allow us to sleep peacefully at night, knowing that we will not be responsible for bringing home the virus and causing harm to our loved ones. This will also allow our elderly ones a peace of mind as well, because I know my parents have been fretting constantly, what if I go back to school? What if I bring the virus home? And I'm sure some of our grandparents have felt the same way. So coming from a multi-generational household, and I know our students are in the same place, I would humbly request that you keep the school closed for the whole semester. Thank you so much for taking the time to listen to me. I really, really appreciate it. And thank you for everything you do for us.
Thank you so much for your comments, Jamie. Next, we have Matthew Levy.
Hello, can everyone hear me?
Yes, we can.
Thank you. Dr. Deloria, esteemed members of the board. New York City began planning its September return to school back in March at the height of the pandemic, and it remains to be seen whether New York City can successfully implement its plan, but at least they created one. I think the return to school plan is excellent, and I want to thank staff and the Back to School Committee for their hard work. I would also suggest not arbitrarily denying these students in-person education until 2021. I certainly agree that right now a return to in-person education is not a good idea. And the return to school plan as currently written does not require the district to move out of phase 0 at any particular time if it's not safe to do so. But there's also no reason to assume as of July 27th that it will not be safe to do so until the end of the year. Given that in-person education is more of an essential good than bookstores or hardware stores, I don't see how it benefits students, especially those students who have been identified as needing it more than others, ninth graders, English language learners, foster youth, and others. I humbly request that the board implement the return to school plan as envisioned, and that the superintendent, together with the County Department of Public Health, create clear criteria that would enable school staff and the public to understand exactly what criteria are being used to determine movement between phases and give them time to anticipate those changes. To say that decisions will be based on data without saying which measures you will be using and what gating criteria will be used both to move forward to the next stage and, if necessary, back to the previous one is meaningless. I think we all understand that there is no substitute for in-person education, and education is a much more important service than hardware stores or restaurants, as valuable as those services are. There's been a lot of talk about how the Bay Area is a hotbed of wanton non-compliance, and I don't think that's true at all. Literally millions of people have locked themselves in their houses, and brothers have not hugged sisters, grandchildren have not seen their grandparents, and as a result, the Bay Area is not New York or Houston or Phoenix or Miami or even Los Angeles. And we're making these sacrifices so that it can hopefully be safer for essential workers. And maybe it's not safe enough yet for teachers, but we cannot know when that will be. And so we need to allow ourselves more flexibility and create a plan.
1 minute.
Thank you very much.
Thank you very much, Matthew. Appreciate your comments. Next, we have Gilvin Peniza.
Hello.
Hi there.
Hi. All right. Good evening. I would like to thank the board for giving me this opportunity to speak in favor of holding school for the fall semester in 100% distant or at home learning. Although I really want to get back to teaching my students and being a school community in person, the reason why I believe we should begin the fall semester in 100% distance learning is because it is a socially responsible thing to do, and we need to be modeling what that is for our students. The risk is too great, especially with the cases rising the way they are. If we open too early with no testing and contact tracing plan, we will just need to close again, and that will be much more disruptive to the students than just doing a great job with 100% at home learning. We need to also think of all the people that work in the schools in addition to students. They need to be protected too. It's the best chance for all of us to get through this. It's a safe, temporary solution. I look forward to being on campus with my students as soon as possible, but when it is safe. Thank you again for giving me the time to speak.
Thank you, Gilvin. We appreciate your feedback. Next, we have Patricia Garcia Lechelt.
Hello, good evening.
Hi there.
Good evening. I would like to thank the board for giving me this opportunity to speak in favor of holding school for the fall semester in 100% distant learning or at home. I'm an attendance clerk at Jefferson High School, And I really want to get back to the kids on campus, and be in a school community as well. But I really believe that the fall semester should be 100% distance learning. And the reason is, as a Latina, I am greatly concerned with the disproportionate amount of Latinx, Black and Brown families that have been struck by COVID-19. I don't want our schools to become a portal for more transmission and for my community to be disseminated. Our kids live in multi-generational households, and I feel that is of utmost importance for us to keep our families safe. I also feel that we need to make sure the numbers are down, not just in San Mateo County, but in San Francisco and Santa Clara County, as well as other counties across the Bay Area. Many of our families work throughout the Bay Area. They may live in Daly City, but work in San Francisco. The family ties also extend beyond San Mateo County. A student may have one of their parents living in Oakland that they live with on the weekends and come back to Daly City during the week. They also may have close family that they visit in San Jose. Because the Bay Area is a large community than one county alone, I urge you to take this into consideration. My family as well has been impacted by positive COVID cases. I know that this is a historically unprecedented situation, and society's leaders at all levels, please must make decisions based on science, principle, and the larger social good. No benchmarks in boosting returning profit and stock market numbers is worth the health and lives of any of our students, teachers, or staff. I look forward to being on campus with students as soon as possible. Thank you for your time, everyone.
Thank you so much for your comments. Next, we have Gary Lorenzen.
All right. Good evening. I'd like to thank the board for giving me this opportunity to speak in favor of holding school for the fall semester in 100% distance or at-home learning. My name is Gary Lorenzen. I am a paraprofessional at Oceana High School. My twin boys are incoming freshmen, and my daughter is entering the 11th grade there. The reason why I believe we should begin the fall semester in 100% distance learning is our schools simply do not have the protective procedures in place to ensure the safety of our students, our staff, and visitors either, as the number of testing positive COVID-19 is on the rise in San Mateo County. I love my job as a paraprofessional. I have no desire to ever retire from it. I miss my students terribly. I cannot wait to be back in the classroom with them. But until we can either guarantee their safety and the safety of everyone working or visiting the schools by putting the proper procedures in place, or COVID-19 comes to an end, which it will at some point, I do not want to put the visitors, my students, myself, or my children at risk. Thank you again for giving me this time to speak.
Thank you very much for your comments, Gary. Next, we have Aliyah Singh.
Good evening, everyone. I just want to take a moment to thank the board for giving me this chance to speak in favor of holding school for the fall semester in 100% distance or at-home learning. I can't begin to explain how much it means to know that you are here to listen to us and to understand the concerns that we have and are truly partnering with us in making this as safe as possible for all involved. There are many reasons why I believe we should start the fall semester in 100% distance learning, but at the forefront for me is really the physical and emotional well-being of myself and my family, my colleagues and their families, our students and their families, and then the broader community. There's no good option in our current circumstances, but I think that if we can take this time to allow our staff and students to really plan effectively, for our students to have an opportunity to learn and to manage the other many complicated factors involved in this global pandemic, it'll provide a much needed sense of structure and consistency that is so vital to our student and staff members' mental health and well-being, as well as their physical health. Students and staff can't focus on education when they're on campus if they're in a constant state of fear for their lives, for the lives of their classmates, or the lives of their families. As a mother to a 1.5-year-old and as a daughter to an immunocompromised parent, the idea of going back to campus is really frightening and has put me in a position where I really had to kind of weigh out the pros and cons. I cannot wait to be able to be back on campus with my students and to support them as a counselor at Terra Nova High School. But until then, I'm hoping that the board will move forward with allowing us to do the best job that we can in supporting our students and keeping everyone safe by doing 100% at home learning for the fall semester. Again, thank you so much for your continued support and your time. It means so much.
Thank you so much for your comments, Aaliyah. And last, we have Kristen Ashford.
You're still on mute, Kristen. You have to unmute yourself.
I can read directions. I'm so sorry.
You're fine.
Good evening. Hello, I'm Kristen Ashford, instructional coach, Zoom expert, and math teacher on temporary assignment at the DO. Thank you to the board for giving me time to speak in favor of having 100% distance learning for the fall semester, as well as for being so thoughtful regarding staff and student well-being during these incredible times. Although I was definitely one of the folks in June saying we needed to go back to school, we needed students and communities back on campus to support them academically and for mental health reasons, I changed my tune to advocate for 100% distance learning after seeing the spike in COVID cases and once Dr. Deloria said we were going at home learning for at least the first 6 weeks. Distance learning is happening in some form no matter what, and it is cognitively demanding on students. Therefore, teachers are making major adjustments to curriculum and assessment because of it. When I imagine that if I were in the classroom, I think I would be better able to invest in planning curriculum and delving into effectively using tech tools if I could prepare entire units, in fact, an entire semester for distance learning, not just seeing each 6 weeks as some AHL Band-Aid, thinking, maybe we'll go back partway through the semester. Additionally, I think of how frustrating the ping-ponging back and forth would be to teachers' well-laid plans, how chaotic it would be for students, parents, and staff alike to quickly balance transitioning to at-home learning, possibly while dealing with a sick staff member or student. Additionally, students returning to mix with hundreds of students, 700 at Westmore in the current hybrid plan, might be inevitable, but it will be hardest on low-income families in terms of health. We know that access to healthcare and COVID testing is hardest for those that have no car, who regularly make decisions to stay at home with health issues until it becomes an emergency due to financial status or for fear of being accused of being a public charge due to being undocumented. Like everyone I've spoken to, I want to be on campus with students and staff as soon as possible, when it is safer. Perhaps when we also have a federal government more in touch with what a real safety net is. Thank you again for giving me time to speak.
Thank you so much for your comments, Kristen. We appreciate it. And that is all the speakers we have tonight.
Thank you. The board, I'm asking if, normally I'll turn it over to you guys to speak first, but I'm asking if you can indulge me and allow me to speak first this time because I have a presentation. Just want to give the slides that I gave at our SMCSBA parent meeting during this meeting. So we just have it on record here for our parents, if that's okay. Thank you, Jake. So on the next slide. So this is, yeah, you can put on the next slide. This is it's a few days old of the dashboard, a picture of the dashboard for the San Mateo County COVID cases by day. We had in the month of July recorded some of the highest case numbers in record. And after this, we did another day. So there was the highest 2 days. And then what's not showing in this graph, which was last week, was another highest day on record for San Mateo County. So this is not the way this is not the trajectory that I would like to see in order for me to feel like it's safe to reopen schools. The other points on here are just some points on when businesses opened, and you can see once we started opening up, cases started spiking. And this is not unique for San Mateo County. This seems to be reflective of most of the other counties. I don't know if it's because of people going to the businesses or just because the opening up gave a sense of we're past this and we're no longer in a serious part of the pandemic. Like it was kind of freeing, people kind of freed up a little bit on how strict they held to guidelines. Because while I am walking around, as when I go outside, you know, people in San Mateo County adhere to masks better than like Sacramento or other places I've been. But there's still a lot of people that I see outside that don't have their masks on or don't have their face covered. It's not as, you know, I would like it to see as close to 100% as possible. I'm not seeing that. I'm also seeing a lot of people on social media and gatherings. And what the county is telling us is that a lot of this is social gatherings and people connecting with families. And I haven't seen any masks in social gathering pictures. So the trajectory is not going in the right place. The other thing that's not reflective is that San Mateo County is the only county that's not on the watch list, but that's not because we don't deserve to be on the watch list. The state actually, almost 3 weeks ago, asked for San Mateo County to be on the watch list, and the county was able to negotiate their way out of being on the watch list. So the fact that we're not on the watch list doesn't mean that it's any safer here than in any of the other counties. The county just worked with the state to keep us off the watch list, and we can go to the next slide. The reason why we're off of the watch list, and this has changed a little bit, but this is still the same, is that we have enough hospital beds to accommodate people who are sick. So it's not that it's any safer here, it's just that there's a bed for you if you get it. So that's one of the reasons why we're off the watch list. And another reason why we're off the watch list, and this pertains to us, is that for those businesses that just opened up, it's extremely difficult for them to shut down again. For any organization to have to open and close, it's really detrimental to their business. And that is what I'm looking at and what I'm thinking about when I'm talking about our own organization, looking at what's happening with the other businesses that are open. This roller coaster of, are we open, are we closed, are we open, are we closed, are we partially open, are we partially closed? It's a terrible way to run any organization. And that's let alone our organization, which has sometimes less resources than some of the businesses out there. Next slide. So there's some areas of concern for me. One, you know, I do understand that children are less likely, from the data that we know, to catch COVID or to present symptoms. When they do have it, they present as asymptomatic, but they still get it, you know. And if you look on this chart, and this is current data from today, you know, 261 children under the age of 9 have caught COVID in San Mateo County. 395 children from 10 to 19 have caught COVID in San Mateo County. So it is possible for students to catch it. The other caveat for these numbers are children under the age of 18 are not tested in the big testing sites. So it's rarer for a child under the age of 18 to be tested in San Mateo County. So there may be many more students out there or children out there that have it that we're just not aware of. The other area of concern for me and the rest of the board is the heavily disproportionate number of Latino, Latinx, Hispanic people that have been diagnosed with COVID-19. It is off the charts disproportional. And when we're looking at the top 5 cities in the county with COVID cases, Redwood City having a little over 1,000 and going down, Daly City is 3rd. 3 things are the things that reflects these cities: high population of ethnic minorities, denser housing, and poverty. And that is a reflection of a good portion of our district. These are all huge areas of concern. One other part is that Dr. Deloria and I have been in constant contact with the County Office of Health trying to get some sort of parameter for us to figure out, is it safe to go back to school? Because I was desperately trying to figure out something that would help me make this decision. So we met with the county health officials to see if we could have a dashboard that they have for the county, if they could create that just for the district level. And the response we got was no, that data would be useless for us. And if you look at the disclaimer at the bottom, I just copied the disclaimer that's on the bottom of the charts. And the first sentence says, because of limited testing capacity, the number of cases detected through testing represents, on the charts they're showing, the number of cases detected through testing represents only a small portion of the total number of likely cases in the county. So if we disaggregate that data by city, it won't even be helpful in telling us exactly how many cases were here. It's only going to represent a very small portion of the people who actually have it. This data is just so the county can have a snapshot area wide, it's like a poll, to make sure that they have enough beds on hand. So so the only thing I can think of is like our SBAC tests, and our SBAC tests aren't really helpful in giving us specific data on like specific classroom on the year. It's more helpful about trajectory. This is the same thing. This is more helpful to the county on trajectory, but it's not really helpful for a specific school year and trying to figure out what's going on. This is just to help the county understand whether or not they're going to have enough beds on hand for cases that could possibly come in. So when Dr. Deloria could also speak to this earlier, I mean, when we talked to them and said, what do we use? Is there anything that we can use? The answer was, I don't know. They're working on it. And they're still working on it. And that meeting was last month. They still don't have anything for us to use as school districts to figure out how safe it is for us so that we can make a determination on whether or not we can send students back to school. The other issues that are scary, and this is on the other slide, next slide, please, is that when we're talking about going back to school, and we look at other countries, they all flatten the curve before they sent anyone back to school. That is not America. And if you look at the United States, you know, that chart is similar to what we're going through right now in the county. The curve has not been flattened. On top of that, they also had robust testing and contract tracing to follow up so that if there's testing that comes positive, there's people that can talk to those folks to see where they were and who they had in contact with. And so that can isolate the cases of COVID quickly. So those people can go into quarantine and we can stop the possible spread. Right now, turnaround time for tests is 10 days minimum. That is not helpful at all for helping us track it or to isolate the folks. And the county is still working on getting their contact tracing program up and running, so that'll be helpful to individual agencies. So we have nothing to help us with guidance. We're nowhere near where any of the other countries were when they sent their kids back in the classroom. And on top of that, we have less resources, outdated facilities, and a lack of the social services that other countries give their citizens so they can get through this safely. You know, the United States is dealing with a reckoning with their lack of social justice issues and social services issues. This is all coming to bear. So I understand the frustration. I understand parents being upset, but I am trying to make the best decision with the tools that I've been handed by our county leaders and by our state leaders. And there aren't any. There aren't many. And on the next slide, this is not something that it's just been a decision that we kind of decided last week. This has been an ongoing process throughout the year when this started to now for the entire board. We get information from a variety of different areas. Our superintendent keeps us up to date with everything that the executive cabinet is doing, and we get any relevant information that she gets from her county meetings with the County Office of Education and with the state. She filters to us. There is a San Mateo County weekly call for elected officials that most of the board participates in every week, where we're updated on what's going on, and that's why I have a lot of this information. We also have another weekly call with the San Mateo County Office of Education that's specifically for school board members, so we can get data that we all participate in every week. I have on my own, I have a monthly call with the county manager of San Mateo County, so I can talk about items that are specific to North County with a lens on equity and really looking at the disproportionate rates and what he can do to help us with those things. I'm also on the San Mateo County COVID Recovery Council. And so I'm getting updates there, and also am constantly advocating for the district and asking for these things that I feel like we need in order to be safely reopened. And then there's the governor's updates, the state superintendent updates, and we have an upcoming call, I think in a week or 2 weeks, that the San Mateo County School Board is organizing that I'm helping with, that is going to be with medical experts from UCSF and Stanford. So we're constantly looking for data, looking for information, looking for ways to help. And I'll just close with, you know, when I did this post on Facebook, and just to repeat some of this, you know, when I ran for school board for the first time, it was to help my school district. It was to help with equity. It was to help with some of the other issues that I saw presented themselves. It was not to make decisions that could possibly lead to students or teachers or staff dying. Like, I just don't feel qualified enough to make those decisions. That's not what I was running to do. And Dr. Loria and other board members can speak more to this. We have been asking for months for help to anyone. I had another meeting with Assembly Member Ting and Senator Wiener, and was completely shot down. They were told, you have the resources that you have, you're not getting more money, and really you should feel blessed with what you have, and you guys need to figure this out. And so that is what I'm doing. This is the decision that I just feel, out of all the poor decisions, I go with, this is the thing that is going to keep kids safe. I'm always worried about equity. I'm always worried about learning loss and increasing the learning gaps that are already been present before this. That is first and foremost on my mind. But we can continue to try to outreach to students who are alive and aren't going through the trauma of families and family members that may have passed away, because a lot of our students live in dense, multi-generational housing with family members who are already working at high-risk jobs. I don't want to add another layer to that. So, you know, I appreciate everyone's comments and viewpoints, but this is how I made my decision, and I open it up the floor to Dr. Deloria and the rest of the board. Thanks, Jake. I'm done.
Thanks, President Salahuddin. I'll wait and let the other board members comment.
Trustee Lee.
Yeah, President Salahuddin, thank you for that presentation. Actually, it's good to see that data again, because it supports the way I've been thinking for a while. So everybody out there, if you've been watching the past few meetings, you know from my comments exactly where I stand on this issue. You know, and it's funny because just a couple of hours ago, when my wife Paige and I were on a walk, we saw a group of teenage girls dropped off from a minivan, walk into a house. This is 2 blocks away from me, and you know, there's no social distancing there. So again, we as a community are not doing the job we're supposed to be doing. And you know, in reading the emails that many staff have sent and the comments today, and several of you have actually reinforced my position, right? Especially when it comes to the fact that our community hasn't done its part to, you know, because it's a team effort if we're going to do this. And the data is proving us right, unfortunately. But I'm also encouraged, because the comments that each of you shared tonight, the comments that you've shared via email these past couple of days, encourage me. I'm excited to hear what it is and see what it is you will be able to do, knowing that the stress of worrying will be gone, because we will be in 100% at-home learning environment, because you can put your best foot forward, your best effort in, and I have absolutely no doubt that you guys will, because the way that you have spoken in your notes and in your comments tonight made me fully confident that you guys are going to be incredibly creative in the work that you do to teach all of our students and to support all of them in every way possible. So thank you so much. And I can't wait to see what you guys do.
Trustee Garrett.
I don't have too much to say because I think President Salahuddin interestingly pretty much summed everything up. So thank you for the presentation. And, again, I like in past meetings, I just want to reiterate, thank you to the teachers and the staff. And, we definitely want to, health and safety is the #1 priority for our community. And, we don't want anyone else to get sick. And if this is what we need to do to make sure that our students and our staff and our teachers are going to be healthy, so be it. And, again, I don't know how much more I can say, except again, that I appreciate all the work that everyone has done to put this together. And also, that you would be risking your health to educate our children. So that, that in itself is just something that I am forever indebted. And this is part of the reason why, I want to be a board member, to be able to make sure that we're doing what's best for, our students and our community. So again, thank you very much.
Trustee Ochapinti.
Yes, thank you for that, President Salahuddin. And everybody, I think I, like many of us, have spoken to this in recent weeks. And, looking at the numbers, I think it's pretty clear to see that our decision isn't really, it isn't necessarily a decision that we have to make. It's not a choice. We have no choice. I think in terms of public safety, there's really no question whether or not we, can be putting ourselves or our community at risk beyond the risk that we're already exposed to. And, just beyond that, as a teacher myself, and as somebody who is Latinx, and of the demographic that's being hit the hardest in our county and in our, in the Bay Area, and who also takes public transit to work. I understand, like, a lot of the needs of our essential workers are those that we should be thinking about as our own needs. And we should be thinking about our most vulnerable in our community, especially those who are undocumented throughout our community, who may not be able to benefit from many of the resources that, the little that, federal and state and even local governments have been able to provide. The little that we can do as school districts, and I think the greatest extent that we can do is to push in the right direction. And I think that's in the spirit of public health, safety, and in terms of safety and security, understanding, like many have mentioned, both those calling in and expressing that online, and those we've heard from over the past few weeks, is that, social services are already lacking and hitting our communities, especially communities of color, the hardest. So the little that we can do in serving meals and providing services is one thing. Going beyond that, to make sure that our environment, our school district preserves and can promote a safe living environment, and one that can empower our students through education, and the best quality education we can deliver through distance learning, by allowing our educators and our students and all stakeholders the space they need to create that for the next foreseeable future, which looks like 6 months. We don't have testing in place. It's been a long time. The numbers we're seeing, the curve in our country is really unacceptable, but that's the situation we're in. And so I'm glad we're leaning in and we're leaning forward on this issue and taking a lead in our county. And I hope the other districts will follow suit as well. I'm certain that many of them are considering the same thing. So we are not alone, and I'm glad that we're taking up this decision here today.
Trustee Tahada.
So I've just been really moved by what everybody's been saying tonight, and all of the many emails that we've received, and the text messages I've received from parents. It makes it easy for us to do the right thing. And like one teacher said, he was filled with dread, thinking about coming back to school because, he's got family he's afraid he's going to pass the COVID on to. And as a parent of a student in this district, I was filled with dread too. And this actually you know, this actually takes a huge weight off me. Because I was looking at hybrid. I will go with what our staff, who's done so much hard work, I will go with what they recommend, because I'm hopeful. But I realize I am not realistic. You know, it is not realistic to think that we could, after 6 weeks, go to hybrid. I mean, and just just the stress of thinking about it. Why put our staff and our families, our faculty in that position, our administrators, my God, everybody, why are we going to put their lives at risk and our families at risk? And, you know, my daughter has not seen her grandfather since March, and I can't let her see him because she took a dance class over the summer. I mean, and it was socially distanced, but I'm not going to we can't take chances at that. And you know, the information about COVID keeps changing, and all the information we get keeps changing. And it's not a matter of Russian roulette. We know there is a bullet in every chamber. We cannot put any of our people at risk. It's ridiculous. And I was on a call with the San Mateo County School Boards Association, and it was like, people are trying to be optimistic about getting back in the classroom. And I was on a chat privately with another board member from another district, and he's not even considering at-home learning. He said, we've got to choose, no options are good. We have to choose one that's less bad. Well, I'm not willing to do that. No, our board is not willing to do that. Our district's not willing to do that. Let's do at-home learning the best way we can and keep our people safe. So I just appreciate all of you. Thank you.
Dr. Deloria, were you gonna? Okay.
Thank you. I appreciate everyone's feedback tonight and the comments by the board, and thank you for those slides, President Salahuddin. I want to add some additional data. I'm sorry I don't have a presentation for you tonight because this only became recently available. It's going to be in the staff and family webinars on Thursday. I certainly invite everybody to participate in that. But there are some additional metrics that the county is starting to post. If you go to their website, you click down to the bottom of data choices, it's there where you'll see it. And there's a number of areas where San Mateo County is in a high alert status. It's in bold red letters, high alert. One of them is certainly for the COVID case rate. Recently, we had a high of 128 cases. Keep in mind that doesn't include children most likely, and it's highly underrated because many people who are getting sick right now, those between the ages of 20 and 40, are not suffering any symptoms that would cause them to go to the hospital. So that data is really underreported, and it's not something we can really use to make these kinds of decisions on. Nevertheless, it's at high alert. The percentage increase in hospitalizations is also at a high alert, with an increase of over 30%. And that connects to what President Salahuddin was talking about in terms of the capacity. Our policymakers are making decisions on whether to open, reopen, close our communities and our businesses based on, is there room in hospitals and acute care areas if people need a bed? And those rates are up 30%. And there's also rates, very interesting, rates on how many contacts, or how many cases have actually been contacted by the county health department. So if you're someone who tests positive right now, the county, again at high alert, has only reached out and connected with 34% of positive cases. They also report that they've been able to reach out to 41% of contacts. Again, another high alert area. So on one hand, we have the governor who's saying that we need to be testing all of our employees every two months. And yet the state can't, or the county, and anyway, the county isn't able to keep track of the contact and case tracking. And I think what's another thing that's really troubling, and Trustee Lee, I'm sure this is a conversation you have with Paige all the time. There's also a metric for the percentage of hospitals and acute care units in our county who have a 15-day supply of PPEs for their employees, and that's at 29%. So to think that school districts should be rushing into any form of on-site learning, to me, would be really careless and negligent. And I completely support the decision to stay with 100% distance learning all semester. There are some bright spots, to coin the language that Mr. Lee used. Our staff, especially our instructional staff, have really, especially in the last 2 weeks, have really stepped up. As you know, they're on summer vacation. There aren't any additional resources to pay people to come to training during the summer, but many of them are already reading books, participating in book clubs, participating in webinars, all kinds of social media sharing that's going on because they want to improve distance learning. What we did last spring was not distance learning, it was crisis teaching. When you take a look at the research around distance learning, there's an effect size of slightly over 1.16. And when you read further into those studies, it's not that distance learning is good or bad, it's what you do with it. And so the plan we have moving forward to really arm our teachers with as many strategies as possible to make distance learning as effective as possible, I'm really heartened to see the plan that's in place. There's if you've been following Facebook at all, there's a recently released book by Hattie Fisher and Fry, 3 real big time people in education. Hattie himself can speak to what things we do in education have positive effects, negative effects, or no effect at all on children. And they wrote a book called The Distance Learning Playbook. You can't buy it on Amazon right now because it's completely sold out. You can't buy it from Corwin or Sage because it's completely sold out. And the reason it's sold out is because it's a real helpful tool for teachers and I would say leaders as well to improve learning in the distance learning venue. 71 of our teachers already, we have about 250 certificated staff, some of them leaders, but 71 teachers already have requested this book and are already working together to build lessons based on some of those constructs. So I'm really hoping the board will approve staying in distance learning all semester. And I don't disagree with Mr. Levy when he commented we have to have key metrics. And it's only recently that more informative metrics have been made available to us. I would also say that we need to have our own lead data locally. So I'll be working with our site administrators, with the district team, and how we're going to collect the health information, including temperatures of all of our staff. So we'll have that kind of data. Right now we're using lag data, as Ms. Salahuddin said. When we take a look at the county's dashboard, that's only interesting, if you're sitting on planet Pluto. We need to have something that's local and something that's predictive. And I'll just end, I'm just really proud of the work we've done together with staff, with labor, and with the board. And that's all. Thank you.
Thank you. And again, we're not going to be inactive during this time as a board. Specifically, we have a meeting set up with now Senator Hill, Assemblymember Berman, and Assemblymember Mullen to continue to advocate for the things that we need, especially testing and how we're going to pay for the testing for everybody when we come back. Food and food service, because the one thing that'll help keep folks healthy is if they have food and we can guarantee that they have food to eat. Ensuring that, the eviction moratorium continues and that we don't lose a good group of our students because they've lost their access to stable housing, which could affect us being able to open and health rates. I don't know when we're going to get a vaccine. And even if a vaccine becomes available or is created, we all know how equity works, and certain people are going to get the vaccine way before other people get that vaccine, So there's other things that we can do that other countries have modeled for us to be safe and we know what these things are, so we can continue to advocate for robust testing, for contact tracing that can go along with that testing, ensuring that we communicate in a way that all communities understand it, the importance of social distancing, the importance of wearing their mask, how you should wear a mask, because a lot are wearing their mask in a way that's ineffective. There's lots of things that we could be doing in this period to pay the way for us possibly getting back in the classroom. So this is not just saying, oh, throwing our hands up and, you know, we're going to be in at-home learning for 6 months. This is some more time for us to continue to fight for the things that we need in order to be safe as a district. And so I'm committed to do that. I know the rest of the board is committed to do that with me. I'm extremely grateful to the entire executive cabinet and to our union president, Monica Casey, for all the work that they've done to get us to this place. I'm really proud of us as a district for how we have pulled together and become more of a family, because we have to be together in order to get through this. And so, you know, I'm ready to get to work. So unless anyone has anything else, I call for a motion on the action item.
Move to approve the revised return to school plan.
Second.
Second.
Awesome. All those in favor say aye.
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 Any opposed? Great. Thank you, everybody. Moving on to future agenda items. If anyone has any items want to add to a future agenda. Oh, okay. So can I get a motion to adjourn?
So
Motion to adjourn.
Second.
Thank you. All those in favor of adjournment, say aye.
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 Thank you,
Thank
everyone.
you, guys. Have a good night, everybody.